Hi Manisha, welcome to the interview. How are you?
I'm good, thank you. How are you?
I'm good, thank you. You have three questions and you have 3 minutes each to answer your questions. You have witnessed a medical officer approach a patient to examine them without washing their hand. You know that this is against infection control policy and practice. What are the professional, ethical, or legal issues you would consider, and what actions would you take?
Thank you for the question. As a registered nurse, my primary responsibility is to ensure the safety and well-being of my patients. The medical officers' failure to wash their hands before examining a patient is a breach of infection control practices, which directly endangers the patient by increasing the risk of infection. According to national safety and quality health service standards, preventing and controlling infection in healthcare settings is crucial to protect patients from potential harm. Hand hygiene is a fundamental practice to minimize the spread of harmful germs, which are the primary cause of healthcare associated infections. Key moments for hand hygiene include before touching a patient and before performing a procedure, as these are the crucial to preventing the transmission of microorganisms between the healthcare workers, patients, and the environment. As a healthcare professional, it is my duty of care to look out for the patient safety and make sure that all the other healthcare workers follow best practices. The International Council of Nurses Code of Ethics Section 2.11 states that the nurses must advocate for patient safety when their health is compromised. Neglecting to address this issue would be a failure to uphold the highest standards of care. The actions I would take are: firstly, I would politely and firmly approach the medical officer and remind them of importance of hand hygiene, emphasizing that their failure to wash their hands would put the patient at significant risk of infection. I would also suggest that they review the hand hygiene posters that outline the correct procedures. Secondly, if the medical officer refuses to correct their actions, I would escalate the matter to the team leader or the infection control team to ensure the situation is addressed promptly. Finally, I would document the incident, noting the steps to took the address the issue to ensure there is a record of the event for future reference and accountability.
Okay, thank
Thank
you,
you.
Manisha. Now your second question is, a fellow registered nurse arrives 30 minutes late for work regularly, which means that they often miss the handover period. How might this impact on the assessment of patient's need and the care provided, and what actions would you take?
As a registered nurse, I understand the crucial importance of handovers in ensuring patients' seamless care. The handover period is essential for the continuity of care and safety of patients. It provides a structured way to communicate critical information about the patient's status, recent changes, and ongoing needs. When a colleague arrives late and misses this period, it can significantly impact patient care in several ways. Firstly, missing the handover means that the nurse may not be fully informed about the patient's current condition, care plan, or any urgent issues that may have arisen. This lack of information can lead to gaps in care, delays in addressing patient needs, and potential oversight of critical changes in the patient's health status. For instance, if a patient's condition deteriorates or if there are specific instructions from the previous shifts that need to be followed, these might not be communicated effectively, leading to potential errors or complications. Additionally, the absence of a nursing during handover can disrupt the teamwork and communication among the staff. It may cause additional stress for the team members who are present, as they need to manage not only their responsibilities but also ensure that the late colleague is being briefed. To address this situation effectively, I would take following steps. Firstly, I would approach the colleague privately and express my concern about the impact of their lateness on patient care and team dynamics. It's important to communicate this respectfully and non confrontationally, focusing on the sheer goal of providing the best care for the patient. I would also suggest strategies or sources to help them manage their time better, such as setting reminders or adjusting their schedule if possible. I would encourage the team to establish a system where all staff members are reminded of the importance of timely attendance. This could involve regular reminders or a review of policies related to punctuality. If the issues persist, I will escalate it to a team leader or manager, emphasizing the potential risk of to patient care and requesting their intervention to address the problem at a systematic level.
Oh, good. Thank you, Manisha. So now your last question is, how do the NSW Health core values of collaboration, openness, respect, and empowerment relate to your role as a registered nurse? Provide an example from your clinical practice.
Thank you for your question. As a registered nurse, embodying the New South Wales Health Course core values, collaboration, openness, respect, and empowerment is important to deliver high quality care to the patient. Firstly, I'll start with collaboration. Collaboration is critical in nursing as it involves working closely with patients, their families, and other healthcare professionals like enrolled nurses, assistant in nursing, doctors, dietitians, physiotherapists, and allied health staff to ensure the safety and well-being of the patient. During a clinical placement, a patient had failed during my shift. I immediately called for help, and a team of healthcare professionals, including nurses, doctor, and wardsmen, collaboratively efficiently to assess the patient, conduct necessary observation, and safely return the patient to the bed. This teamwork ensured the patient's safety. Secondly, openness. Openness involves being transparent, honest, and accountable in all interactions. It encourages open communication, sharing information freely, and being receptive to feedback. This fosters trust with patients and colleagues, ensuring care is delivered with integrity. During my clinical placement, I made a medical error by giving the wrong medication to a patient. I immediately informed the registered nurse, took responsibility, and ensured the patient safety by checking their vital signs and informing them about the error. I also notified the doctor and completed an incident report. To maintain transparency, I commented about the incident during the handover as well. Third, respect. Respect means treating everyone with dignity, kindness, and empathy while recognizing and valuing diversity. It involves active listening, being considerate of their feelings, and honoring patients' autonomy and cultural differences, fostering a supportive environment for both patients and staff. During my clinical placement, a female patient requested a female nurse for due to her cultural beliefs. I respected her request and informed my team leader, who ensured that the patient received care only from the female nurses. Additionally, when another patient refused medication, I respected their decision and informed the resident nurses and document about the situation. Finally, empowerment. Empowering patients and staff to manage their health is empowerment. It involves giving patients the knowledge, support, and resources they need to make decisions. The staff development, progress, innovation, and initiative are encouraged. Empowerment boosts confidence, competence, and ownership. Example, while on my placement, there was multicultural health community health. I cared for a patient from a non-English speaking background who had specific dietary and cultural preferences. I advocate for the patient by ensuring that their dietary needs were respected and involved them in discussion about their care in a way that honor their values. Thank you.